Another interesting presentation that I was able to acquire was from Dr. Mark Hurst. He's an MD, PhD, and he talks about MRI contrast, but it's a non-narrated presentation. So again, I'm going to just narrate it for you, see if it'll help any. Okay, types of contrast agents. We have paramagnetic, superparamagnetic, diamagnetic. Paramagnetic is a positive contrast agent, it is injected intravenously. It works by shortening the T1 relaxivity of the tissue that once it's been absorbed. Superparamagnetic and diamagnetic are both negative contrast agents, and they work on both T1 relaxivity and T2. They have a darkening effect on the images. Now, we've said this before in a previous module, but we're going to cover this again. In radiology, we image the contrast itself. If you're doing a BE, an upper GI, and you're seeing the contrast on the film, you are looking at the actual liquid. That's not the case in MRI. In MRI, we inject the contrast or we drink this contrast, but we're not capturing the liquid on the image. What we're capturing is the effect that liquid had on the surrounding tissue and how it changed its magnetic susceptibility. When the tissue's magnetic susceptibility has been changed, it will respond differently to the pulse sequence as compared to the other tissue, the non-enhanced tissue. It's those changes that we capture on our MR images. Unlike this exam, a barium enema, what you're seeing is the actual contrast that we put into the patient's body. Here, orthograms, we injected a contrast into the joint. What you're capturing on that image is the actual liquid you injected. On the CT of the brain, you injected IV contrast. It goes to the vascular system, it enhances in the brain, and yes, I am capturing the actual liquid that was in their arteries. Not on the brain MRI though. What you're seeing here, enhancement, it is not the liquid itself. It is the effect that liquid had on the tissue. You're capturing that changing T1 relaxivity. That is not the liquid we injected. Okay, so going back to the contrast itself, chelates. This was interesting. Chelate actually means claw. It is the claw that holds on to that dangerous gadolinium that's going to be running through the body. It surrounds an ion and makes up that cage around it. A chelate of gadolinium occupies all the available space around the ion except one. Water molecules exchange in and out of that one spot, and when in that spot, the spins have an extremely short T1 time. This accelerates the overall relaxation. This slide, acquired from Baylor Pharmaceuticals, demonstrates a little bit more of the composition and how these contrast agents are bound together with that chelate. Noticing here, between the non-ionic and the ionic, the linear format into which the gadolinium is housed in the chelate, it's kind of a strand or a string. It can easily be broken and leaving that gadolinium just to float around into the tissue of the patient. Unlike when we look at the macrocyclic, looking here, you see this gadolinium very protected in within the chelate, bichelate molecules. So NSF most likely is caused by this gadolinium agent just roaming free in the body. It's preventable by a thorough screening process and getting an actual estimated GFR on them. This website, which I'm going to take you to here in just a second, is a website in which you can calculate the GFR on a patient. You actually put in their creatinine level and it will give you its glomerular filtration rate. When we're talking about contrast, we've been talking about this injectable contrast this whole time. I do want you to know that there's other kind of contrast agents that can be used in MRI. You can use water as a contrast agent. You can use juices as a contrast agent. Here's a picture of an MR colonography where pineapple juice makes a great negative agent when you're doing an MRCP to darken the stomach. To give you an idea of how the juices appear on MRI, this slide here shows where a test was done with little tubes with different types of juice, and then the pulse sequence was ran. I want to give you a chance to actually look at this, study it. Look at the water At the very, very bottom, it's marked with a W on the left side of your screen. Look how bright it is on this T2 sequence. And this is a T2 weighted sequence. Look at orange juice on the top row. Take a second and actually find which juice had the darkest effect or darkest appearance on this T2 sequence. Take a second and look at it. Pineapple juice, blueberry and apple juice, Ferrumoxyl, I can't pronounce some of these things, concentrated gastrografin. So if I was going to do that MRCP image that we saw just a few minutes ago, and I wanted to darken out the stomach, and that's a heavily weighted T2 sequence, these are the types of juices that I would use. If I wanted the stomach and the intestines to appear really bright on a T2 weighted sequence, what would I give them to drink? How about water? Water appears very bright on the T2 weighted sequence. So this just gives you another idea how even oral contrast can be used in MRI to enhance the image. So again, just for a quick summary, some real important takeaways on this. The types of contrast agents are paramagnetic, superparamagnetic, and diamagnetic. Paramagnetic, the most common. It is a positive agent. It affects T1 relaxivity. The superparamagnetic and the diamagnetic are negative contrast agents. They will affect T1 and T2 relaxivity. Depending on how the gadolinium is bound to the chelate molecule determines whether how stable it is. Remember, NSF is caused by the gadolinium unbinding from its chelate and just staying within the tissue. Remember, gadolinium, unlike regular X-ray contrast, if the gadolinium comes unbound from the chelate molecule, it will not get filtered out of the body. This is where the clearance criteria becomes very important. Know your facility's clearance protocol. What we gave you here was just some of the national standards, I guess, between different facilities. If you're over 60, that is a risk factor. If you have a history of renal insufficiency or dialysis in the past, you're a high-risk patient. These people should be screened very carefully and possibly even be considered for alternate imaging sequences that don't require contrast. Consult with your radiologist. No contrast is safe from NSF as far as gadolinium is concerned. The one and only safety feature that will ensure safe practice is you, the technologist. You must practice safe MR standards. You must clear that patient. You must also consult with your radiologist with any questions that you have. Thank you for your attention, and we'll see you again next week.